Well, I have an impossible task, which is how do you summarize all of this discussion and so many moving statements, brave commentaries, stepping out as patients, as parents, and I'm not sure it's doable, but what we did is capturing, do we have the slide of the quotes? I thought we'd at least share a couple of things, the quotes from today that we're moving, and then back up to a few final summary comments. I wish that diagnosis had made a difference. I'd be a fool not to try. Very interesting. A little of lots of things is better than a lot of nothing. I think we heard that reinforced in some other comments. We need to know much earlier. That's an appeal, obviously, to earlier diagnosis and earlier triggers to knowing complications. We want him to be able to embrace his childhood. It was like someone had turned the lights back on. I don't know how we put shape around that, but boy, is it important. And so I thought I would try to capture what's been said in a few general themes, recognizing it doesn't do justice to everything that you've said, and more importantly, everything you've all lived. So let's talk about, very briefly, common causes, collaboration, translating patient voice into meaningful measures, better characterization of NPC progression, that is the natural history. It's what you've had several comments this afternoon about, and continued shared learning. So very briefly on each of those, just thinking about common cause and common frustrations. We heard many similar messages coming through from families, regardless of whether it was early, late. The progression is something that needs to be understood better, and that we need to remember patient first in all our development in whatever. The importance of the patient's view and perspective trumps all. Second thing is relating to that common cause. I'd wager highly that everyone in this room, whether they wear a hat of a physician, a pharmacist, a nurse practitioner, and whether they're from the FDA or a manufacturer or a parent or a caregiver, that we all share the common interest of wanting to see these developments. We just need to understand how to standardize it and do it so it's to the satisfaction of all of our critical thinking. Collaboration. Development breakthroughs will require active engagement of all the parties involved. A clear agreement on definitions of how we define disease and progression, and also when those things have reversed. Reversibility came out in a lot of our discussion. Third, relating to translation of patient voice to meaningful measures. I think that reversibility plays in again, and we heard it from many of you, and we also heard it in Dr. Roman's comments moments ago, which is really compelling. How do we look at better predictors of disease, intermediate endpoints, so we don't have to go to survival measures? And then fifth, better characterization of patterns of progression. That goes to more data to understand sub-patterns. And I have to say, I look at this and think of cystic fibrosis of 20 years ago, and how that field has changed from essentially no interventions to multiple drugs for multiple genotypes. And we're finding out that CF has many different disease patterns, and I think we'd probably wager that in Niemann-Pick C that we may see a number of patterns. The more we understand that, the more personalized or targeted interventions may be fostered. And then finally, continued learning, shared information. The old saying from Satchel Paige, the pitcher of almost a century ago, none of us is as smart as all of us. And that's so important, but without sharing the information, none of us is smart. So I hope that message resonates through. A couple final comments before I turn things over to Sean. So a big thank you to FDA, Dr. Roman and colleagues, really tremendous to hear not only your introductory comments, but your responses. That's very important for us understanding what other information may help you in decision processes. And of course, to Dr. Patterson, I think that was a very insightful and balanced approach. A huge thank you to the patients and family members of patients who stepped forward and served as panelists or commentators. Again, really moving and memorable. And I come away with the thought of, as you bring structure to the patient voices, I'm impressed that there's a multi-organ system process here. For patients, it's head and abdomen, and for families, for parents and siblings, it's hearts that are most affected. How do we figure out how to embrace all of those things and reverse cognition issues, falling, swallowing, and measuring that better? So my final comment is NPC as an acronym for Hope Without Hype, but the N for new therapies, so critical, the P for progression, reversed, and progress in care, and C for collaboration, shared learning. So I thank you really for all that you've contributed and all that we'll capture and bring forward to the Voice of the Patient report, but that's only a starting point. So I'd like to close by asking you to applaud for yourselves, because you're the ones who are really shaping all of this. Thank you very much.
Well, if there's one thing I know how to do, it's close out a meeting. So, but I'm going to just reiterate, thank you to all for being here. Thank you for everybody who's watching on the webcast. But again, thank you to the families for traveling. Thank you for your remarks. Thank you for sharing your voice. I know some of you I've met over the last few years, but a lot of you, I've only seen you on, newspaper clippings or, your websites or Facebook. So it's been incredible. It's been a real blessing to finally meet you and speak with you here. So thank you. Also, please know this isn't just the end of this meeting. This isn't the end. This is the beginning. This is the beginning of being able to share your voice with the FDA and with everybody. And we're going to continue to keep you involved and keep you up to date on how we're going to be doing that. The first thing first is that the Voice of the Patient report will come out in a couple of months. It'll be posted on the NPC PFDD website. I'll make sure everybody's aware of the timing of that as that happens. And then this will actually broadcast. I believe we're going to be putting that entire thing on the website as well and other communications that will come out. And so we will just continue to keep you involved and up to date. With that, dinner tonight, I know some of you have to jump on a plane or are going to be driving. Travel safe. But please, if you're here, join us for dinner. It's at 5:30, not at 6 o'clock, back in the same room where we had breakfast. Grab a meal and grab a drink on us and enjoy some casual conversations. There is no program, nobody's speaking. Just come and hang out with each other. The last thing I'll say is this. Working at Notre Dame and involved in this community, one of the things I always do at the end of my emails and my texts and stuff, I say, go Irish, beat NPC. But after today, I'm going to change that to go Irish, together we will beat NPC. Have a great evening. Thank you for being here.